Thanks so much for joining us today for the webinar. Today, we're going to be talking about tallying your immunizations and exemptions for the final report, which is the sections E through H, or pages 3 and 4. My name is Kristen Kelly. I'm a health educator at Multnomah County Health Department, and joining me today is Kristen Merriman. She's a nurse here at the Health Department as well, and she's going to be helping me by answering some questions if you have them along the way. We're working in WebEx today, so hopefully you can see my slide in the center of your screen. It just says tallying for sections E through H. And then over on the right, there should be some panels that have a chat box and a Q&A box. If you don't see those panels, there's some icons in the upper right-hand corner, and if you click on that icon, it should open up that panel for you, so that if you do have any questions, you're certainly welcome to enter them into that Q&A box or into the chat box, whichever you prefer. I don't care. We'll be watching both. I may or may not be able to answer them during the webinar because I am going to try and get through it all in 30 minutes because I know you guys have some very busy schedules. But my coworker Kristen hopefully can answer them, and if not, I will be sticking around afterwards, and I will make sure that every question gets answered before I hang up the phone today. All right, so let's get started. So without a doubt, probably the most common errors we find on the immunization reports are on page 3, sections E, F, and G. It's pretty complicated and sometimes not very clear what's being asked of you. And as of last year, there's also a new section on page 4, which is section H. And so I know that for some people that one still feels really new as well. So let's understand first why we even do these reports. Why are they so important? The purpose is that they are a statistical summary of your students' levels of immunization, and this helps the county and state know where kids could be at risk in case of an outbreak. It also helps parents know how their school or daycare compares to other schools or daycares in terms of vaccine coverage and exemption rates. So good, accurate statistics here, good data, can help us all make better decisions around public health. In addition to that, a newer Oregon law requires that all schools and children's facilities make publicly available some information about immunizations and exemption rates, and that's the reason for Section H. And we'll talk a little bit more about Section H in a little bit, but in order to have all the information to comply with this new law and to fill out the reports, we need to accurately tally your students' vaccines and exemptions. So let's get started on that. So for today, what I want to do is I want to show you how to use the tally worksheets. The tally worksheets hopefully came in your original packet that came in the mail back in the fall. If you don't have that anymore, I will show you how to get a new copy of the tally worksheet. I want to show you how to use the tally worksheets, double check yourself for accuracy, and then how to complete the reports themselves, sections E, F, and G, and H. So let's take a look at this tally worksheet. The first thing to know about the tally worksheet is that it is just that. It is a worksheet, a place for you to do your calculating and counting, but you don't have to send it to us with your report. It's just your own workspace. Later, I'll show you what does get sent to us. By the way, if you don't have a copy of the tally worksheet, this link down here, I don't think it's a live link. I don't think you'll be able to click right on it, but maybe you could jot it down. This is where you can get your own copy of the worksheet if you don't currently have one. I'll give you a more live link also a little bit later. So if we take a little bit closer look at this tally worksheet, you'll notice that there are 4 different worksheets, one for each of the age groups that we need you to report on. Tally worksheet number 1 up here is for preschoolers, daycare, Head Start. For some of you, that's the only one you'll use. Tally worksheet number 2 is for kindergartners. Number 3 is for 7th graders only. And then tally worksheet number 4 is kind of the catch-all for the other grades. It's grades 1 through 6 and 8 through 12. The columns list the different vaccines that we're looking for and the required doses for each. So here you can see this is DTaP, looking for 4 or more doses, and so on. And in each chart there is a row to put a tally mark if the child has the vaccine, and another row to put the tally mark if the child has a non-medical exemption. And we'll practice all of this in just a second. Let's see. All right, so the very first step that you're going to want to do is get your immunization records back out again and sort them all by age group. And the first age group that we're looking for is daycare and preschool. And in this case, we're looking only at the kids who are older than 18 months. So if you have children in your daycare who are younger than 18 months, you can separate those out for this step. Babies are statistically a little too hard to track because their immunization statuses change so rapidly in that first year and a half. So we'll set those aside. We're only interested in tallying daycare and preschool kids older than 18 months. We're also looking for kindergartners, 7th graders, and then everyone else, the first through 6th graders and 8th through 12th graders. So let's zoom in on one of the tally worksheets here. Right now we're looking at the tally worksheet number 1. This is the one for the preschool kids. Notice we're looking for a certain number of doses for each of these vaccines. So when we review each of the records, we're going to be checking to make sure that that record meets the criteria listed in these boxes. So does the child have 4 or more doses of DTaP? Does the child have 3 or more doses of polio? And so on. If they have the required number of doses, we'll put the tally mark in the has the vaccine box. If they have the non-medical exemption, we'll put the tally mark down in the has the non-medical exemption box. Every now and then, you might have a student who only has 3 doses of DTaP, and they're up to date because perhaps they got that 3rd dose about a week ago. So clinically, they would not be able to get a 4th dose right away. It's too early for them to get a 4th dose. But they're up to date, so we won't tally them because they don't have the 4 or more doses that we're looking for in this exercise. So that'll happen from time to time, and I'll show you an example of that when we do our exercise here in just a minute. If a child has a tally in each of the boxes in the row, they would also get a tally in the all box. So you'd put the tally in each box as you go, and then one in the all box at the end. Once you have all the kids tallied, then you can add up the tally marks in each box. And now's a good time to do a double check. So for each of the tally worksheets, there is a tip down at the bottom here, and the tip offers you a way to double check your work and make sure that you actually tallied all the kids in the age group. So, and this tip for this age group reads that for varicella, MMR, Hep A, and Hib, the number in the has the vaccine box plus the number in the has the non-medical exemption box must equal your adjusted enrollment for that age group. So for me, in this case, I have 7 kids in my pre-K. That means that for these vaccines with the asterisks, these 2 boxes should equal 7. So here's 7 plus 0, that works. 6 plus 1, that equals 7. Hep A, 7, and Hib, 7. Looks to me like I tallied everyone. Okay, so we'll do this for each of the age groups. And remember that if you have a 7th grade, they have a tally sheet down here, all their own. And the final tally sheet is for 1st through 6th graders and 8th through 12th graders. Also remember that different age groups have different numbers of doses. So be sure to look at the tally sheet for each age group to see what it is you're counting. So for instance, we were looking at 4 or more doses of DTaP for those pre-K kids. But once we start tallying kindergartens, we're looking for 5 doses or the 4th dose after the age of 4. Similarly, over here in tally worksheet number 4, for those 1st through 6th graders, we're looking for 5 doses of DTaP, But once we get into 8th and 12th graders, we're looking for Tdap. So just make sure to read the tally worksheet. It tells you what to look for. All right, so let's practice. Let's see here. Okay, we're going to tally some kindergarten records. I have a pretend kindergarten here, a very small kindergarten with 5 students. And I have all their records over here on the left side of the screen. And we're going to go ahead and tally using tally worksheet number 2 for kindergarten. And we'll do it together. So we'll start with this first record, John Doe. The first thing I want to do is look for his DTaP. Does he have 5 doses of DTaP or the 4th dose after the age of 4? Well, looking at his record, I can see that he has all 5 doses, so I'll put a tally in the has the vaccine row for that vaccine. Next is, does he have 4 or more doses of DTaP or the 3rd dose after age 4? He does indeed have 4 doses of polio, so I'll put a tally in the has the vaccine box. Next, varicella, we're looking for 1 dose or a history of the disease. He's got 2, no problem. I'll put a tally in the has the vaccine box. MMR, we're looking for 1 MMR. So sure enough, he has his first MMR. I'm going to put a tally in that box. Next, we're looking for a 2nd measles shot. Typically, this is in the form of a 2nd MMR, as it is in John's case. He's got his 2nd MMR, so I can put a tally in that box. Next, I'm looking for 3 or more doses of hepatitis B. He's got them. That's a tally. 2 doses of hepatitis A. He's got them. That's a tally. And since John has a tally in every box on the row, he also gets a tally in the all box. Okay, that was an easy one. Let's do another one. Next is Davy Fisher. So let's do the same thing again. Does Davy have 5 doses of DTaP? He sure does. That's a tally. Does he have 4 doses of polio? Yes. Varicella, we're looking for a single dose. He's got it. MMR, he's got his first dose, and he's got a 2nd measles dose in the form of another MMR, so I can put a tally there. He's got plenty of hepatitis B, the 3 or more doses I'm looking for. He has his 2 doses of hepatitis A, that's a tally. And since I was able to put a tally in every box, we'll put 1 in the all box as well. All right, let's see what's next. Next is Sarah Smith. Now, Sarah, I can see I've left myself a little note here. Sarah only has 4 doses of DTaP, but she is up to date. And if I look, I can see that this 4th dose was given after the age of 4. So that meets the criteria for a tally in the has the vaccine box. She had her 4th dose after age 4. Polio, she has 1, 2, 3, 4 doses. Looks like she just got that 4th dose, so she's good to go. She can get a tally in the has the vaccine box. She has 1 vaccine, 1 varicella, that's a tally. 1 MMR, that's a tally. A 2nd MMR, tally. 3 hepatitis B, yes. 2 hepatitis A, yes. And looks like we got a tally for the all box. All right. Now this next one, Suzy Jones. Suzy has a non-medical exemption for varicella. I've got all the paperwork for it. It's a valid non-medical exemption for varicella. So let's see how we're going to tally this one. She's got 5 doses of DTaP. We'll put the tally up in the has the vaccine. 4 for polio. Now for varicella, she does not have the dose, but instead has a non-medical exemption, so I'll drop down to the 2nd row to put my tally mark there. Now with measles, mumps, rubella, look at that. She has 1 MMR, so she'll get her tally in that 1st dose for MMR, but she does not have a 2nd dose of MMR. But look how recently she just got this, this MMR. So she's clinically unable to get that 2nd dose quite yet. So she's up to date, but I cannot put a tally in that 2nd measles box yet. So I will skip that one and move on to hepatitis B, where she has 3 doses. That's a tally. 2 doses for hepatitis A, that's a tally, and nothing in the all box because I didn't put a tally in every box on the row. All right, so the next one is a little tricky. The next one is Judy Johnson. Now, Judy has a non-medical exemption for every vaccine. I have all the paperwork here. You can see her vaccine education certificate with every box checked. So her parent has decided to exempt her from all the vaccines. However, when I look a little closer at her immunization record, I can see that she has some vaccines. So let me show you how I'm going to tally this. In this case, she has 4 doses of DTaP, and that 4th dose was given after the age of 4. So since I'm more interested in knowing what Judy is protected from than what she's exempted from, and she is protected from diphtheria, tetanus, and pertussis, I'm going to put that tally up on the has the vaccine line. But for polio, she does not have those 4 doses of polio, so we'll use the non-medical exemption there, and I'll put a tally in the has the non-medical exemption box. Varicella, same thing. I'll put a tally in the non-medical exemption. Measles, mumps, rubella, I'll have to use the non-medical exemption both for the 1st dose and the 2nd dose. Hepatitis B, she actually has all 3 doses for hepatitis B, so I'm going to put the tally in the has the vaccine box. Hepatitis A is a non-medical exemption. So nothing for the all box because we were kind of all over the place. Okay, so now the next thing to do is go ahead and count up my tallies. Okay, and then I can do my double check. And for this age group, the double check says that for varicella and MMR, the 1st dose of MMR, the number in the has the vaccine box plus the number in the has the non-medical exemption box needs to equal my adjusted enrollment. So for me, my adjusted enrollment is 5. So 3 plus 2 equals 5, that's good, and 4 plus 1 equals 5, that's good. I didn't miss anybody. Okay, so that was all of our kindergartners. So let's, before I move on to the next step, I wanted to just kind of give you a little closer look at this one, tally worksheet number 4. Remember, this one is for 1st through 6th graders and 8th through 12th graders only. 7th graders have their own tally sheet. There are some different dose requirements here for the different age groups, so be sure to take note of that when you're using this tally worksheet. Remember that hepatitis A is only required for students in 1st through 8th grade. So on this worksheet, you will be tallying hepatitis A only for kids who are in 1st through 6th grade and 8th grade. If you have kids in 9th through 12th grade, even if they have Hep A vaccinations, you won't tally them. Don't tally them, but do tally for those younger kids. Also, I went ahead and added a little section to the tally worksheet this year that has some other information that you'll need for Section 8. It's your total enrollment for kindergarten through 12th grade and your total enrollment for kindergarten through 8th grade. Those are some numbers that you might want to count up before you go to fill out the reports. So once your tally sheet is all filled up and counted, you have all the information you need to fill in sections E through H. So let's take a look at that. So here is, I'm just going to zoom in a little bit, section E, F, and G. So this is page 3 of the report. And let's go back, take a look at it. So when you go to fill in these sheets, sections E, F, and G are pretty straightforward. Section E uses all the information from tally worksheet number 1. Section F uses all the information from tally worksheet number 2. And section G uses all the information from tally worksheet number 3. So let me just sort of walk you through how we would do that. I'm just going to center this a little bit better. There we go. All right. So you start out by filling in some demographic information at the top of the report. then we need to know the enrollment. In my case, I have 7 kids in this preschool. This is how many won't be counted because they're getting counted at another school. Children who are 18 months of age, this is where you're going to subtract out those babies. I don't have any in my pretend school, leaving you an adjusted enrollment. For me, it's 7. Next, it asks me to fill in the number of children with the indicated number of doses. So that's all the numbers from the top row of my tally worksheet number 1. So I can just copy those numbers over. For DTaP, there were 7 kids who had those doses. Polio, there were 7. Varicella, 7. MMR, dose number 1, there were 6. Or for the first dose, there were 6. Hepatitis B, 5. Hep A, there were 7. Hib, 7. And there were 5 students who had tallies in every box. The bottom half of the form is about exemptions. So first they want to know how many kids do you have no record at all for. Hopefully by now you've got records for everyone. Medical exemptions, those are rare. Next is how many kids have non-medical exemptions. In this case there were 2. And then we like to find out where those medical exemptions came from. Did they come from the online module or from a healthcare practitioner? In my case, I have 1 of each. So now I can fill in the information from the bottom row about the numbers of kids who had non-medical exemptions. So there were 0 for DTaP, 0 for polio, 0 for varicella. There was 1 for MMR. Now notice down here, they're broken out by measles, mumps, and rubella. That's MMR. So we're going to spread that 1 out across all 3. Hepatitis B, there were 2. Hep A, 0. Hib, 0. And no one had all the exemptions. Okay, and then you would continue in that way. You can see I've already filled in the kindergarten and the 7th grade, but you would continue in that same way, filling in all the numbers from the tally worksheets right onto the report. All right, so now for section H. It collects information in a very similar way. It's just we have to do a little bit of math with it. Now, if you have just a preschool, pre-K, or daycare that has no kindergarten program or any other grades besides just preschool or pre-K, you do not have to submit this report. This report is only submitted by facilities who have, even if you have only just 1 kindergartner that you teach kindergarten to, you need to go ahead and submit this report. So the first thing you'll do is fill in your demographic information, select or check the boxes that indicate which grades you serve. So in my sample academy here, I have kindergarten through 12th grade. The next thing I need to know is my total enrollment, the enrollment for all my kindergarten through 12th graders. In my case, I have 33 kids. How many kids get counted somewhere else? My adjusted enrollment is 33. So now it's asking me for the total number of students who have all the vaccines for their grade level. So since I'm looking for kindergarten through 12th grade, I have to start by counting the 5 kids in from my tally worksheet number 2, the 5 kindergartners, plus the 8 7th graders on my tally worksheet number 3, plus the 20 kids on my tally worksheet number 4. These are my 1st through 6th and 8th through 12th graders. So when I do that math, that adds up to 33. So with polio, I have 18 kids here, plus 7 7th graders, plus 4 kindergartners. That equals 29. Varicella, I have 3 plus 7 plus 15. That equals 25. MMR, that is 18 plus 6 plus 4, that's 28. That second measles dose is 3 plus 6 plus 18. That equals 27. And for hepatitis B, it's 20 plus 6 plus 5, and that equals 31. The next question is the number of students in kindergarten through 8th grade. So that's the number of kids that are required to have that Hep A vaccine. So how many kids total are enrolled in the kindergarten through 8th grade? For my academy, that is 25 kids. Now, how many kids in kindergarten through 8th grade are complete for their Hep A vaccine? So that, for me, is 4 plus 8 plus 12, that is 24. And then how many kids had all the vaccines for their grade level? That's 15 plus 6 plus 3, that's 24. Okay, so I would do the same thing then with the non-medical exemptions. I've already filled them in for us over here. And that is it for Section 8. So Section 8 isn't so bad, it just takes a little bit of math. So then once your reports are filled in, let's go back here, then let's talk about what happens next. So hopefully you've been canceling those exclusion orders. Now that exclusion day has passed, hopefully all the exclusion orders have been canceled. And then you should be writing in the date that you received those updated records here in Section D on page 2 of the report. And then a Y or an N, yes or no, depending on whether they missed any school. So if they were excluded and missed school because they got you the information after February 15th or late in the day on February 15th, you'll put a Y in this box here. Otherwise, it would be an N if they missed no school. So then you're going to send a copy of this page to us along with a copy of pages 3 and 4 if you need to submit page 4. And just get those all to us here at Multnomah County. You can do that by fax. That's a great way to get it to us. Our fax number 503-988-5847. Or you can definitely attach those to an email, scan them and attach them to an email to us at immuprogram@multco.us. If you do want to put them in the mail, that's fine. You should probably put them in the mail in the next couple of days because the deadline for this report is on Monday. So we need to get them in our offices by Monday. And as always, if you have any questions or you're feeling stuck, you can definitely give us a call. Our hotline is 503-988-4724, or you can ask us questions at that same email address, immuprogram@multco.us. And looks like I came in at 29 minutes. That's not bad here. So if you have any questions, now's a great time to ask them, and we'd be glad to answer any questions that you might have. We do have a question about whether or not you need to attach a copy of updated records. If they were mailed the exclusion letter, do you need to send us copies of those updated records? And the answer is no. We rely on you to be the gatekeeper here. So if you've reviewed the new records and you feel that that child is indeed up to date now, then you just mark them as up to date. And cancel that exclusion order, and we don't need to see the copies of those records. Good question. Any other questions? Well, for those of you who need to take off because I know your schedules are so busy, I want to just thank you very much for joining us today. Thank you for all your work and for keeping our kids and communities safe. Don't hesitate to give us a call if you have any further questions. I'll stick around for a little while longer to answer any questions that might come up that you think of. But otherwise, I hope you all have a great day. Thank you.